Good morning, everyone, and thank you for joining. And I'm gonna be giving a minute here while everybody joins in, but we wanna uh, yeah, welcome you today and to the Medicare Connector training. And as everybody comes in, I'm just gonna give a quick introduction. So my name is Omar Flores Cordero. I'm the director of Medicare here at LeClair Group, and I'm joined today by Ashley Spetsova. Ashley, if you want to say hello.
Hello, everybody. I hope you take a lot from this webinar, and I'm excited to be here.
Great, thank you, Ashley. And she's gonna be manning the chat. So if you have any questions, feel free to post them in the chat, and we'll make sure to either answer them via Ashley, or if it's something that seems pertinent for the whole group, we'll go ahead and answer it for everybody together. So just a little bit about LeClair Group. So we're a field marketing organization, or FMO, based out of here in Woodbury. And our mission is to have every person in every community have a trained agent that can help them. Uh, and we really want to make sure that you as an agent have all the tools and resources that you need to feel that you are able to help your clients to the best potential. So uh, a little bit of housekeeping here. I do want to make sure that you know about our events that are coming up, and we're very excited because next week we are starting our roadshow. We're going to be in 14 cities. And we're starting in Minnetonka. I'm gonna go ahead and share my screen here just so that you guys can see that list. And where is my share button? Here we go. Screen two. And if you haven't registered yet, you can do so at leclairgroup.com/driven roadshow, and driven roadshow all as one word. And Ashley just dropped the link there on our chat. But we're really excited. We're gonna have Richard, uh, our CEO, and also Emily, our COO. We'll be giving kind of a State of the Union address, just talking about what's going on in the industry, kind of more of a global level, if you will. And then we're gonna have the two CEs. One is gonna be more Medicare oriented, and the second one is about first dollar. So that's gonna be touching on more of those kind of what normally they call kind of ancillary products, but there are things that are gonna fill in the gaps. So you won't want to miss it, and we hope that you join us. So without further ado, we'll go ahead and get started. So today, we're going to be concentrating on one specific item in Medicare Connector, and it's really, what is the client experience? And uh, when you send them a quote, and also when you send them a link to your personalized website, what do they see? And one thing to note with this is that we do encourage you as an agent to go out and try this on your own. So that's the best way to learn. So today we're teaching you where to click and what the main views are, but it's also as important or even more important that you go yourself and try it out. Create a dummy profile, put your email in there or your cell phone if you're gonna send yourself a text link, and try it out. See how it feels. What is it that the client sees, and try it firsthand. That way, when you're with your client, you can tell them very confidently and say, hey, this is what you are going to receive. This is going to be the experience. And this is where you're gonna go click, and then that client, it's gonna have a much better experience overall because they know what to expect. So I'll go ahead and start going here. So if you are somebody that is just starting to use Medicare Connector, make sure that you check out our webinars that are posted on the LeClair portal, and that's at leclairgroup.com. If you don't have access to the LeClair portal, please reach out to your sales relationship manager or reach out to one of us and we'll get you connected and make sure that you have access to our portals. You have access to Medicare Connector as well. So we'll go ahead and get started. So everybody should already have this page, you know, linked in your favorites, and you go here and you log into your connector. And then at this stage, so we have already created a profile for someone, and really we are at the stage where we are telling that person, hey, it looks like there there's a couple plans that are suitable for you, and I want to send you this quote. That's the step where we're in. So we've already created the profile. We've maybe talked through a few options, but we want to make sure we're sending them um, that quote so that they can review it later on their own. So what we're gonna do here first is, let's say that I want to send a quote with 3 plans. So, and in this scenario, I've been quoting the 0 premium plans. So that's gonna be this one, the UCare one. Let's say I also want the UHC. And maybe I also want the Health Partners Smart with the 0 premium. So you can add up to 3 plans to the quote here. And when you go to the top of the screen, they're gonna start showing up right here. So if you decide later, hey, you know what, I added this plan and I don't want it, you can go ahead and click the X and that will remove it from 3. You can also do just 1 plan if you decide to. It all depends on where you are in that conversation. So then from here, pretty self-explanatory, you just click send quote. And this is going to go ahead and ask you, how would you like to send this quote? You can either do email, you can do a text, phone number. In today's scenario, I'm gonna do it via email. And then it also allows you to put a personalized message. So if there's something specific that you wanna put here that is pertinent for that person, you can go ahead and do that. It's gonna also tell you what plans you're including, so it's confirming the plans. And it's also going to ask you, which costs would you like to view first? So I had added in this profile 3 pharmacies. So right now, CVS is the one that's gonna be the main one, if you will. So that's the first one that shows up. They can go ahead and toggle between the 3, but CVS is gonna be the first one. So if that's not the one I want, I can change it to Walgreens, for example, and then it's gonna change it so that Walgreens is the one that shows up first for the client. So then you go ahead and click send quote. And once you send the quote, it's gonna give you the code and it's gonna tell you, hey, we sent the quote. You can go back to the profile and you can also create a task, basically a reminder that will live in your dashboard here and you can put whatever message you want here. So follow up on quote, um, enrollment in June, for example, and I'm gonna make it due, mid next month because I want to make sure we touch base again. One thing to note is, and you'll see this on the screens forward, is uh, there's two pieces that are going to be sent to the client. So it's two separate emails. One is going to have that authorization code, and the second email is going to have the actual link to the page where the quote is, where they will put that authorization code. So they give you the code here. They also will give you the code in another place, and I'm gonna go to that. So if I'm in the profile and I'm sorry, so this is, you're looking at the plans. If I go to the profile of that person, so maybe you sent the quote and later they call you, hey, I misplaced the code. Can you give me the code to see my quote? You can come to the profile and the quote history is going to be right here. This also serves as your proof that you sent the quote. So it's going to be time stamped and it will have that code in here as well with the message that you wrote. So that's something that, comes in handy just as a reminder or as you're having further conversations. Uh, Something to know is when you send it, it may take a few minutes uh, for the email to be sent to the client. So this morning I was doing a test and there was a little bit of a delay. It was about 5 minutes between when I clicked the send quote and when I got the emails. So um, my recommendation is just have a little patience. Sometimes it can take a little bit. Right now, in this quote that I just sent, I already got the emails with the authorization code. So here is what the client gets. So here's the email. It says your authorization code sent from licensed sales agent. Gonna have this picture of a nice lady, the name of the client. So I have put my own name. It's gonna have the code. And then if you had put your picture in Connector in your profile, it's gonna have that picture right here. So it you, that way, this is something I always recommend, make sure that you have your picture and your information because that's gonna personalize it even further and the client's gonna know, okay, this email is legitimate, they were expecting it, and they can grab the code. I did see a question that if the client didn't receive, can it be resent? Absolutely. You can go back in here and you can select the plans again. And I'm gonna show you here to continue to plans. And you can send a quote, the same plans. You can send it again. Or if you wanted to send different plans, so maybe you wanted to send more than 3 options. Maybe it was 4. Okay, then you can go ahead and um, you know take these out and then put the other 3 or however many and send the next quote. So, and then as a reminder of what I just spoke about, how to put your picture, you just go to your name and up here under account overview, your picture is going to be right there. So that's that personalization piece. So the client got one email with the code. They're going to get the second email that is going to have the link to view the quote. So you see that right there. So we're going to go ahead and click on this. And then that is going to bring them to this page. Again, here's my picture. So I keep, uh, you know, hammering on that personalization. If you didn't put a picture, it's just going to be that blank space. Uh, and then here I had to put the authorization code. So I'm just going to go ahead and type it out. I do recommend that you tell your clients to type it out versus copying and pasting it. Sometimes the copy and pasting it puts space before or after, and then it will make this not take the code. So my recommendation is go ahead and type it out, but up to the client. So I put the code, and then this is going to be what the client sees. And as a reminder, and that's also a question that came up here, is to be able to send quotes, it does need to be a carrier that you have under LeClair. So that functionality is specific to carriers that you can um, do the enrollments through us. So if you have a carrier that you don't run through LeClair, or maybe you're not appointed through, you wouldn't be able to send the quote electronically like this. Now, kind of the other way of doing that would be that you would pull in connector the side-by-side comparison, and then you may print it as a PDF, and then you would send that to your client that way. So that would be kind of the backdoor way. So this is what your client gets. So I had the 3 plans. They're going to be side by side. From here, they can go in and see the plan details. If they so choose to, they can go straight and add it to the cart, and they can continue with the enrollment. If they end up actually doing an enrollment through this will be attached to you. So it came from you as the agent, so it will have your agent codes in the end. But a few other things to know is, from this page, they can go to compare the plans. They can shop all available plans. So, and then they can also shop for other types of plans, from here. So, you know, it does give quite a bit of flexibility as far as what they can do from this page, even as far as editing their prescription. So maybe they forgot one prescription, they forgot to tell you, they can come in here and kind of self-service and edit the prescription, add it, or maybe they are not taking something that they see there and they can remove it. So um, so from here, we're gonna go ahead and compare these plans. So and I know that, when you look at these numbers, people may be thinking, oh, we had that $2,000 out of pocket this year. So some of these plans don't have all the drugs that I plugged into this profile. So that's why it's pushing it over the limit. So, but in here, they can do that comparison side by side of the plans. And this view you should be kind of familiar with, because this is that same view that you as an agent would get if you do the side-by-side comparison. So all that same information is going to be here. The links for pharmacy, plan documents, it's all going to be right here for the client. So from here, let's say that I decided, okay, I compare the plans, I'm ready to go. Maybe I really was hoping to have some dental coverage. So I saw the health partners as the optional comprehensive dental. So that's why I'm picking this one. Okay. you can go ahead and add it to the cart. If there was a different plan in the cart, it will give you this, and then you can replace it. And then from here, this plan looks like it has that additional comprehensive dental, so you can add it to the cart right there, and then you can continue to apply. So from here on, the client will go through the application process. So this is a place where, I'm not gonna go much farther forward with it because I don't want to actually submit an application. But just so that you get a taste of what it looks like if you haven't done an application, this is going to have just your basic information first. Then it's going to start asking for Medicare numbers, and it's going to ask questions about mailing, also billing, etc. And then it will have all the disclosures. Uh, as you can see also, there's links to a paper enrollment form, a summary of benefits, and the notice of discrimination from right here. It also lists my information as the agent, and it also has the picture right up top and my name. So those are all things that I recommend always reminding your clients. So if you're going this direction of sending a quote, that you tell your client, hey, make sure if you're gonna go through an enrollment, so if you're gonna go that far, make sure that in the page that you're still seeing my information in that page to make sure that you're in the right space. And you're gonna know with your clients who's gonna feel comfortable doing this, and then who's gonna not feel as comfortable doing it. So if you at all feel that they're not going to be comfortable, then you as the agent then can take over and go ahead and do another appointment and complete the enrollment with them. So at this point, I've given a lot of information on sending a quote, what that's going to look like. Um, Ashley, are there any questions that people had that we should address in the group?
No, we addressed all the ones that were in our actual chat here. However, one that I frequently get is if the client is completing this themselves, will my agent information automatically load on their personal application?
Yes, so that's a great question, and the answer is yes. So this is going to be linked to you, and like I said, make it, you just want to kind of prep the client and let them know, hey, make sure that when if you're going to do the enrollment, that you are seeing my information on the site, and that will kind of be the hint of you're in the right place to do this enrollment. And then once they do an application, so they go through, complete the enrollment, you as the agent will get notified. You'll get an email, and uh, and it will say, so and so put in an application. You'll be able to see a copy of that enrollment through their connector profile as well.
Perfect. That was my next question I get all the time is will I get notified of the actual application being submitted? So yes. The other thing I get questions on is will it notify me if the client has opened my quote?
Oh, that's a great question. So at this point, there's not any indication that they have opened it on your side, uh, unless there's something else, Ashley, that you have seen.
There isn't, but what
Right.
I frequently tell the agents I work with that have those sort of questions is to just set a follow-up task under that client's profile, for like a
Mhm.
week out. That way you still have it in your side of things to be able to reach out to them and say, "Hey, sent it to you. I haven't seen the actual application go through. Would you please get out there and look at it? Or if we need to reschedule something, we certainly can."
Right. Right. Yeah. And um, that's a great point. And Uh, one question I'm seeing on the chat is, will the enrollment, if you do an enrollment through Connector, will the AOR and commissions go through LeClair? So one thing that's a reminder, so if you when when you as an agent have a contract with the carrier and it's under LeClair, those applications, enrollments that you do and your clients get attached to, uh, they come under LeClair regardless of if you do a paper application, if you do it through the carrier's enrollment portal, or if you do them through Connector. So that all gets tied together, if you will, on the carrier side. So using Connector, the idea here is that this enables you to be able to see all of the plans that or carriers that you offer that are available to do online enrollment. You can see them and quote and enroll side by side. And then it also creates a platform where the view is the same for all the information you're getting. So we all have been in the different carrier portals where they have different structure on how they present their benefits. In here, it puts it all in a standardized way so that when you are quoting, you know where you go to see the copay for doctor visits, you know what the view is going to be for the prescription drug coverage, and you're going to be able to kind of explain that to the client in a confident manner because you know exactly where you are looking at. So.
And just a reminder from that, or a key takeaway is that the only carriers you will be able to actually send a quote, including, is going to be the ones that you are aligned under LeClaire for. So if you have a Blue Cross Blue Shield
Mhm.
Minnesota or a UHC contract elsewhere, either that be direct or through a different FMO, and we do not have access to that information, it will not be in our connector. You will not be able to send a quote. Could you still do add non-licensed plans and view the quote for that? Yes. Unfortunately, your client
Mhm.
would not be able to receive the quote and they wouldn't be able to enroll in it.
Right. Right. Yeah. And we know that there's going to be scenarios, uh, where you may be doing a comparison between a plan that maybe you are not currently offering, or not contracted with, and that's where, printing to PDF, and that, a tip on how to do that, you just click print, and in in most computers, they will give you a save as PDF option here, and that's how you would do that. So then you're basically saving a document that you can attach in an email to send to your client, and you can do that, from any of the pages in Connector. You can also do that as a strategy to, save basically a screenshot of what you're seeing, for uh, later review if you'd like.
Correct. And then one more quick plug on kind of the carrier side. If you do have a contract with a carrier outside of LeClaire, it is the season where we can actually pull those in under us. So if it is something where you want to have access to all of them in one tool, all we have to do is transfer that book into LeClaire, well, your appointment, not your book. And then you would get access to
Mhm.
that in our Medicare Connector tool as well.
Right. That's a great reminder. And as we all went through this last AEP, if you were thinking, oh, I'm missing a carrier or something, this is a great time to get the appointments, if it's something that you're not offering, or if you want to bring it under LeClaire, it's a great time to have that conversation. Uh, because if we, as it happens, if we wait until the end and right before open enrollment, then the carriers will have blackout periods and they have longer expected times to come back with the appointments and stuff. So we want to make sure that we do things ahead of time, and so that you are set in the best way possible, for open enrollment. So I just wanted to show just quickly also that view, um, if you're sending out a link, I know that we went more in depth in our last connector, uh, but just as a review of where you get that. So this would be a scenario where you're just either putting this on your email or on a website, and then people literally go on self-serve. So that would be by copying this link, this 2025 link, and then you have to copy it from here and then uh, either paste it on the email or paste it on to a browser. One caveat that I'll mention here, because this is something that comes up sometimes, is once I pasted that link, you saw that it kind of changes. So if I go in and try to copy and paste this link now, this is a different link, and it won't lead you to the page that is attached to you. So you want to make sure that you're actually grabbing the link from connector and pasting it, and then that's the one that you use, as it comes out from there. So this is
Exactly. And
what,
then
go ahead.
I was just gonna say one more quick reminder, if you are pasting that link on your website or in your email, ensure that you are following your agency's compliance associated with it.
Right. Yeah, and we know that, some agencies, may have, specific protocols on how to use links and whatnot. So that's a great um, reminder. And when they use your link, so it's like, again, we want to give the reminders here. So this has my agent name, my picture. This is attached to you. So any plans that are going to show up here are only the ones that you are contracted through LeClair to do, and that they can do actual quoting and enrollment. So if a client goes through the whole process, so they click the link, maybe they added preferences, looked at their drugs, um, and then they enrolled, then that will be attached to you as the agent. And if they go through and do an enrollment, you'll be able to see that. Also, if they go in and create a username password, or like create an account, then once they have created the account, you will also be able to search for them by name. So, uh, if you have somebody going out there, I would encourage them to create an account, because then you would actually be able to see what they worked on, and if they plugged in any medications and whatnot, and then you can take it from there. All right. So I think we've had a lot of great questions, and I want to make sure that we get through all of them. Uh, there was one that if they self-serve, will you receive commission? Uh, and the answer to that is, you know, this will still be tied to you as the agent. So as long as it's a plan that's commissionable, then uh, you'll be able to get those commissions for it. Um, So there's a question. I assume we would need to collect the scope before we send a link. That is a great question. So it all depends on what the path is here. So if it's something that is posted on your site and they self-serve through the whole process, so they click the link, they they looked at the plans and they enrolled, then that technically does not need a scope because they self-serve the whole way. Uh, if it's somebody that maybe talked to you on the phone and then they say, can you send me quotes? Can you send me plans? Then that will need some sort of scope, because now you're having contact with them. So that that's a it's an important point to differentiate between, if the path is they fully self-served, they will not need that scope. Let's see. Will you still receive the enrollment notice from the carrier? The answer is yes. Uh, the you get a notification from Connector saying, "Hey, an enrollment was received uh, from XYZ client," and then from then on, once an enrollment is done and is captured in Connector, whether you completed as an agent, whether it was a phone enrollment that you know where you did it in person or phone, or whether it was uh, the one where you sent to the client, or if it was through a quote or from the link, it doesn't matter kind of who did it. Once the enrollment is done and is sent to the carrier, that pathway is the same. So it gets sent to the carrier, and then the carrier is gonna process that enrollment, and it's gonna follow the same rules with them. So they have to notify the client within 10 days and so forth. Those rules stay the same. All right.
There is just one more question, and that's
Mm,
just could you give a quick refresher on where the client's drugs could be placed in, both in the client view and in the agent
mhm.
view, please?
Yeah, so we're in a great screen for that. So if the client goes in and plugs in their drugs, those are they can go and do it here, add preferences. So you guide them and say on the left hand side, you add preferences, and that's going to include the prescription drugs. Now, as we know, there's a million pathways to get to this screen because if you start shopping for the plans and you look at the prescription drug details, there's going to be edit buttons kind of peppered through the site. So that those are other ways to get to this, but this is the main one, if you will. Uh, and once you're here, you plug in the medications, and it's the same experience. Start typing, and there you go. If it's somebody that you sent the quote, so going back to the view quote site. So in here, let me make sure that I have the right code. Mm, right, there. So if it's something where we sent the quote, oh, I got the wrong code. Let me see. I may have followed the wrong link. I've done multiple quotes today, so trying to keep my email straight. All right, so here we go. Uh, Okay, so in this view, and this is, I took it from a profile that I had already created. I had already plugged in medications, but for sake of the argument, let's pretend there was no prescriptions. In this, it would just not have anything listed, and it would have one of these add buttons. So right here, the client could go in and add the prescriptions. So one way that people have used this in the past is they've sent a, they got the scope of appointment because they're talking to the client, they're meeting with them, and they mean to send them actual plans. So they got the scope, and then they maybe send, if they were interested in this UCare plan, for example, they say, okay, I'm gonna send you a quote. Can you add your prescriptions? And then we'll have another meeting, and then we'll talk about how those prescriptions affect the plan and how that will be covered. So that's, a roundabout way. In today's day and age, we have other tools like Retire Flow that you can use to gather the prescription drug data as well. Um, you know, that it's more efficient in that. All right, so I think we've gone through all the questions so far. So we'll give a couple more minutes here if anybody else has questions. Otherwise, we do want to thank you for joining us today. And, we believe that, Medicare Connector, it's a cutting edge tool for doing quoting and enrollment. And we're very excited this year. I was just over at the Connector conference, and they were talking about, what they're thinking as far as enhancements for the rest of the year. So there's more to come. We'll be talking a little bit about it in Healthapalooza. We'll have the Connector people there. We'll have Retire Flow guys over there as well. So make sure that you come to that later this year, and you watch for the seminars as they come. We're very excited, and we're also always open for feedback. If there's ways that you would like to see this work for you, if there's something that you're thinking, oh, this is a little clunky, I wish it was this way, um, please send that feedback our way, because this is a work in progress. We're with that feedback, we help them make this the system better, and they are very open to that feedback. And there's things that we have brought up before that they make the changes. So without further ado, thank you again, and I hope everybody enjoys the rest of your day. We should have a nice warm day. It's already 48, my phone says, but it's supposed to get up to 61. So I'm ready to get out there and enjoy the sunshine.
Thank you, everybody. Have a fabulous rest of your day.
All right, bye everybody.